Hello, my name is Dr. Jennifer Cork. I'm a doctor of social work, a licensed clinical social worker, a late diagnosed autistic adult, and the author of What's Your Anxiety Level, which is a cognitive behavior manual for treating neurodivergent kids and teens with co-occurring anxiety. But today I want to talk about autism and empathy. So there is a harmful and false stereotype that autistic people do not feel empathy. And while this has been debunked by research, because it was taught as fact for so long, it has continued to persist. And I've had clients as recently as within the last year who were told that they couldn't be autistic because they showed and displayed empathy. So while I have worked with some autistic people who had limited empathy, for example, a teenager who told me that strangers, like he would go to Walmart and the Walmart greeter would say hello and he'd walk by, wouldn't acknowledge, wouldn't respond, wouldn't say hi back. And his response was, "Why should I? We'll never see them again." So he had limited empathy for a lot of people in the world, but was very empathetic towards his family, especially his younger sibling, who was also autistic and non-speaking. When his sibling would struggle and have meltdowns, he was the one on the floor helping his sibling self-regulate. So he did have empathy just for a small number of people. What I see more often is that autistic people have what we call hyper empathy or extreme empathy. And that's where the autistic person maybe is watching the news or sees someone being bullied or harmed, and they feel such strong empathy that it can cause physical distress and sensations in their body. A researcher named Damian Milton came up with what he called the double empathy blind. And so his theory is that while autistic people may not always understand the intentions and thoughts of others, which may be why they appear to be not empathetic, is that they're not reading the social cues of the other person, that goes both ways, that the neurotypical people or not autistic people around them are misunderstanding the autistic person's nonverbal cues. So again, there's that struggle with cognitive empathy where the autistic person just misreads the situation. The kind of the opposite, where the neurotypical person misreads the nonverbals of the autistic person. Or at times the autistic person does feel empathy, but because of that hyper empathy, they become dysregulated, and while they are feeling empathy, they're not able to display that. So I strongly encourage you to do a little reading, research, talk to the autistic people in your life and find out what is their experience with empathy. And if you've been told that autistic people do not feel empathy and you've never questioned this before, please pull that information out of your brain, throw it in the trash, because it's not true. Thank you.